Hello everyone, welcome back to my channel. If you are new here, I am a public health professional, and through this channel, I try to educate people about the field of public health and how to navigate your career in this field. Today's topic is how you can add value and also make money at the same time as a public health professional, i.e. what all sectors you can work in public health. So a lot of people have come up and asked me, where do you work exactly as a public health professional? Do you work in a hospital? Do you work with the government? Can you work in the private sector? Where do you work? So I thought it was about time for people to gain a real sense of what we do out in the real world. So in my last video, I talked about how as public health professionals, we work towards and focus a lot on prevention and health promotion. If you haven't gotten a chance to check out that video, I will link it down below in the description box for you to go and check out. So public health systems are complex and requires the coordination of multiple organizations. This could be a public health department, typically a health agency, which works in tandem with schools, employers, medical providers, faith-based organizations such as churches, temples, etc. And that makes sense, right? Because these entities and bodies are the ones who have access to a lot of people, especially different population groups at a time. Careers in public health go well beyond just creating awareness about living healthy and trying to prevent diseases through various initiatives. Public health professionals can go on to flourish in a lot of different sectors that could range from being a law enforcement officer for prevention of substance abuse to making policies with the government and even being a marketing professional for wellness campaigns and so much more. So without further ado, let's jump into all the sectors that you could be working in and are available for you to work as a public health professional. So as I said before, a lot of people have this misconception that public health professionals can only work with government agencies. However, that's not true, because public health touches upon almost every sector out there in the modern world, and hence your options are really broad, and a lot of them. As someone who wants to pursue a career in this field, either with or without a degree in public health, you could be working in a variety of different settings, which include but not limit to these 5 sectors: the public sector, the private sector, the academic sector, the non-profit sector, and also hospitals and medical facilities. Since there's so much we could be talking about each and every sector and your options available as a public health professional in each of those sectors, today we're just going to be touching upon 2 of the broadest sectors out of the 5, the public sector and the private sector. So let's talk about the public sector first. Here you could be working with your local, state or national level government. You could also be working with national and local level health agencies and departments. They're 2 different things. And you could also be holding government jobs, including health administration, public health nursing, or disaster preparedness. A prime example includes the Center for Disease Control, which is the CDC in the US, if you've heard of it, which is the country's go-to federal agency for all things involving public health. They employ a broad range of professionals, which include doctors, nurses, epidemiologists, toxicologists, communicators, researchers, scientists, economists, and many more. Its mission is to respond to disease outbreaks, ensure the safety of food and water, protect against environmental hazards, prevent injuries, and ward off public health threats that range from leading causes of death to bioterrorism. So as you can see, the options are really limitless, and you could be working for a variety of different topics and problems in public health. Next, we have the state and local health departments. So these are health departments that are located on a state or provincial level and further narrowing down to a local level as well. Their work is pretty much focused on the same things I mentioned for the CDC, just on a smaller scale. Many state and local health departments are usually paired with their local social services division, in order to ensure their population's physical well-being and also address environmental and behavioral issues. Lastly, in the public sector, we have the funding agencies. So if you've ever had a chance to work on a research project with a professor at your university or college, and if you've been super lucky enough to be paid, where is that money coming from? It's these funding agencies or organizations that put out funding calls in the form of competitions, which our clinicians and researchers apply to, win, and get money in the form of grants or awards. This funding enables research explorations that have led to the development of, for example, the MRI, us having an enhanced understanding of how viruses can cause cancer, insights into cholesterol control, our different processes in the brain, and also the life-changing work of about 144 Nobel Prize winners. So if you are someone with a strong interest in science, laboratory or clinical research, or even administration work, policy or executive careers, you may find a strong and solid career path in this space. Now, moving on to the private sector. So within the private sector, you could be targeting private health-based organizations and foundations. So this could mean finding jobs in the insurance companies, pharmaceutical manufacturers, and also other healthcare facilities. Talking a little bit more about the insurance companies. So no matter what health insurance landscape is in your country, most of these insurance companies are involved in public health initiatives. One thing that is common for all of these insurance companies is that they have access to large and rich amounts of health information. They use this information to identify trends and then launch specifically tailored health promotion initiatives, even programs for disease prevention, and ultimately do outreach to underserved populations. Their main aim is to improve quality of care and decrease their costs through a population health management approach, which is in fact a borrowed public health perspective. Professional public health analysts, managers, leaders, and educators are required to guide these organizations beyond simply treating diseases to ultimately prevent avoidable sicknesses, decrease unnecessary care, and overall improve health and wellness. So if this is something that interests you and you think you probably have it up your sleeve through some work experience of your own, this is definitely an area you could tap into while navigating your career in public health. Then we have the corporate sector. In recent years, the private sector has been really involved in developing healthcare policies and also manufacturing pharmaceuticals that target specific health issues that are identified by us public health professionals. A classic example of this would be none other than our infamous pharmaceutical companies that have developed vaccines for COVID-19. That right there is the integration of the private sector with the public health world. Now, they do so by either hiring public health professionals within their own companies or developing partnerships with public health leaders or associations, public agencies, community organizations, and also schools. Lastly, we have our favorite consultants. So if you are looking for consultant type of work, you could definitely do so by working as a liaison between the public health professionals and the different organizations, either in the public or private sector, or even the other sectors that I will mention in the next video. So that is it for today's video. I hope you found some value through these insights into the private and the public sector. We will be talking about the other three sectors in my next video. All right, that is it for now. And today I want to leave you with one of my favorite quotes, which goes, "Whatever you decide to do, make sure it makes you happy." I actually like this quote a lot because I see myself applying it to my own personal and professional life. As you saw in the field of public health, there's so many different sectors and organizations you could work in, and also different kinds of health problems you could be contributing to. So as long as you choose to work for something that brings you true happiness and joy and is meaningful to you, go for that one, and that decision won't go wrong. Thank you so much for giving me your time today, and if you found anything valuable, definitely do give this video a big thumbs up and subscribe to the channel as well. I'll see you in my next video, and thanks again for joining. Bye bye.